Good morning to all. Today our discussion topic is hip bone. Hip bone we already talked in our lower limb region in detail. So today in this session we'll discuss hip bone, its external features and attachment and relation of a hip bone only related with the abdomen and pelvic region. So the hip bone is a large, innominate, irregular, flat bone. It presents a constricted central part which is cup-shaped depression and it is known as acetabulum. The hip bone has three parts. The superior portion, that is ilium, antero-inferior portion it is known as pubis, while the postero-inferior part it is known as ischium. This three components joined at a acetabulum, and which initially it is separated by a triangular cartilage, but later it is replaced by the bone. This hip bone is expanded above and below the acetabulum. It shows the oval or triangular foramen in front and below this acetabulum. So this foramen known as obturator foramen. The hip bone is formed by one dorsal segment, so this is ilium, and two ventral segment, pubis and ischium. As we already know that the acetabulum is articulate with the head of femur and form the hip joint. Now how can we determine the side of a hip bone, whether it is of right side or left side? So for this, keep the hip bone in a such a way that the acetabulum goes laterally. The flat expanded ilium forms the upper part of a bone and it lies above the acetabulum and goes upward. The thin pubis goes anteromedially and the thick ischium goes postero-inferiorly. The obturator foramen lies below the acetabulum, and the obturator foramen is bounded anteriorly by the thin pubic bone and posteriorly by the thick ischium bone. So by these 4 points we can determine the side of a hip bone. Anatomical position, for this keep the pubic tubercle and the anterior superior iliac spine in a same coronal plane. The pelvic surface of a body of pubis directed upward and backward, and the symphyseal surface of a body of a pubis lies in the median plane. So these are the 3 points by which we can put the hip bone in an anatomical position. Now first we discuss about the ilium bone. So the ilium it is a upper expanded plate like part of the hip bone. In the lower part it forms the 2/5 portion of the acetabulum. The external features, it has two ends, upper end and the lower end, three borders, anterior border, posterior border and the medial border, and three surfaces, gluteal surface, iliac surface and sacropelvic surface. So we'll discuss each feature in detail. First take a iliac crest. So the iliac crest, it is a broad convex ridge which forming the upper end of the ilium bone. It can be felt in living at the lower limit of a flank. If we talk about the curvature of this iliac crest, vertically it is convex and it goes upward, while antero-posteriorly it is concave in front inwards and concave outwards behind. Now what is the highest point of a iliac crest? So the highest point lies just behind the midpoint of this iliac crest. It means this is the anterior end of iliac crest and this is the posterior end of the iliac crest. So this is nearly approximate, this is the midpoint of a iliac crest. So from this midpoint just behind, so somewhere over here, so this is the highest point of a iliac crest. It is little behind the midpoint of a iliac crest. The level of iliac highest point of a iliac crest at the interval between the spine of L3 and L4 vertebrae. Now, ends of iliac crest, it has two ends, anterior end and the posterior end. The anterior end of a iliac crest, it is known as anterior superior iliac spine. It is again a landmark and we can easily felt in a living. The posterior end of iliac crest, it is known as posterior superior iliac spine. It is marked by a dimple 5 cm lateral to the second sacral spine. Now this anterior superior iliac spine, it gives attachment to the lateral end of the inguinal ligament. Now morphological division of this iliac crest. So we can divide the whole iliac crest into two segments, long ventral segment and short dorsal segment. So this is anterior superior iliac spine. So this is the ventral segment, and this is the posterior side of iliac crest, so short dorsal segment. Now this long ventral segment, it forms more than the anterior 2/3 of the crest. So this is anterior 2/3 of the whole iliac crest. So this much portion, it is the long ventral segment. This is anterior superior iliac spine, this is anterior superior iliac spine, and from here to here. So this is long ventral segment. It is more than 2/3 of the iliac crest. The features of long ventral segment, it has outer lip, this is the outer lip, this is inner lip, and in between these two lips, this is the intermediate area of a long ventral segment. Now the short dorsal segment. So this short dorsal segment, it forms less than posterior 1/3 of the iliac crest. So this is short dorsal segment. The external features of this short dorsal segment, it has two slopes, lateral slope and the medial slope. Both these slopes are separated by a single ridge. So this is the ridge that separates the lateral slope from the medial slope. Both these are the features of short dorsal segment. Now what is tubercle of iliac crest? So it is the elevation on the outer lip, lies just 5 cm behind from the anterior superior iliac spine. This is outer lip of the long ventral segment. So on this outer lip, 5 cm behind from the anterior superior iliac spine. So this is anterior superior iliac spine, this is outer lip. So from the anterior superior iliac spine, 5 cm behind on the outer lip. So this is the tubercle of iliac crest. Now attachment on a long ventral segment, this much long ventral segment. So we divide the long ventral segment into two. The long ventral segment we divide into two part. This yellow line indicate the anterior 2/3 of the long ventral segment, and this red light indicate the posterior 1/3 of the long ventral segment. So we divide the whole long ventral segment into two part, anterior 2/3 and posterior 1/3. Now attachment. So we start from the lateral to medial. We discuss only the attachment related with the abdomen and pelvis. So from outer to inner or lateral to medial, in anterior 2/3 of the ventral segment, it receives the insertion, this iliac crest receives the insertion of external oblique muscle. In a same plane, in a posterior 1/3 of ventral segment, it gives origin to the latissimus dorsi muscle. Medial to this external oblique, this whole extent of ventral segment, it gives origin to the internal oblique muscle. So internal oblique muscle arises from the whole long ventral segment. Medial to it, it gives origin to the transverse abdominis muscle only from the anterior 2/3 of long ventral segment, while quadratus lumborum take origin from the posterior 1/3 of long ventral segment. Medial to it, there is a fascia transversalis in anterior 2/3 part, and thoracolumbar fascia around the attachment of quadratus lumborum muscle. So these are the attachment on the long ventral segment of iliac crest. Now short dorsal segment, as we already seen that the short dorsal segment has lateral slope and medial slope, and both these slopes are separated by a ridge. So this lateral slope gives origin to the gluteus maximus muscle, and this medial slope gives origin to the erector spinae muscle. Two ligaments, introosseous ligament, introosseous sacroiliac ligament and dorsal sacroiliac ligament, both are attached on the medial margin to the attachment of erector spinae muscle. So this is the attachment site for the introosseous and dorsal sacroiliac ligament. So these are the attachment on the short dorsal segment. Now anterior border of ilium. So this is the lateral view of hip bone. This is anterior superior iliac spine. So anterior border of ilium, it starts from the anterior superior iliac spine, then it runs downward towards the acetabulum. So this much is a anterior border of the ilium. In the upper part of anterior border, it has a notch, while in the lower part there is one elevated area. So this elevated area, it is known as anterior inferior iliac spine. So this is about the anterior border of ilium. Now posterior border of ilium, this is iliac crest, this is the posterior end of iliac crest, it is known as posterior superior iliac spine. So the posterior border of ilium, it starts from the posterior superior iliac spine, then it goes downward and reaches to the upper end of the posterior border of the ischium bone. So this is the whole posterior border. Just below to the posterior superior iliac spine, one elevated area is there. So this elevated area, it is known as posterior inferior iliac spine. If we go more downwards, then we'll find one large notch, large deep notch. So this large deep notch, it is known as greater sciatic notch. So these are the posterior border of ilium. Now medial border of ilium. Medial border of ilium, it runs on the inner aspect or the pelvic surface of the ilium. It starts from the iliac crest and reach up to the iliopubic eminence. So this is iliopubic eminence. So this medial border, it starts from the, it runs on the pelvic surface, start from the iliac crest to iliopubic eminence. So this is the medial border of ilium. In its lower part, it forms the iliac part of the arcuate line. So this is iliac part of the arcuate line. or inlet of pelvis. Now iliac fossa. Iliac fossa, it is a large concave area. It again lies on the pelvic surface, inner surface. It's situated just in front of the medial border of the ilium, and it forms the lateral wall of the false pelvis. So this is iliac fossa. Sacropelvic surface. Sacropelvic surface, again it is on the pelvic surface, inner surface of the ilium. It is situated just behind to the medial border of the ilium. This sacropelvic surface has three parts. This above portion, that is iliac tuberosity, this is articular surface, and this is pelvic surface. Now the iliac tuberosity. Iliac tuberosity, it is the large rough area lying just below the dorsal segment of the iliac crest. So this is the dorsal segment of iliac crest, just below on the inner aspect and behind the medial border. So this area, in its it is known as iliac tuberosity. Iliac tuberosity, it is raised in middle part while depressed on above and below. So this is whole iliac tuberosity. In middle part it is elevated, while in above and below it is depressed. Anterior inferior to this iliac tuberosity, this is the articular surface. This articular surface articulate with the sacrum and it forming the sacroiliac joint. The pelvic surface is smooth and it lies anterior inferior to this articular surface. So if we go more anterior inferior to this articular surface, so this surface it is smooth, and this is the pelvic surface of the ilium bone. So this is just below the dorsal segment, inner surface, and behind to this medial border, this is the iliac tuberosity. Anterior inferior to it, this is the articular surface. Anterior inferior to this articular surface, this is the smooth pelvic surface, and this form the lateral wall of a true pelvis. Along the upper border of this is the greater sciatic notch, and this is the upper border of a greater sciatic notch. So on this area, this surface is marked by a sulcus. So this sulcus present on the upper border of the greater sciatic notch, it is known as pre-auricular sulcus. So this sulcus is deeper in females than in males. So this is sacropelvic surface. Now the attachment on this sacropelvic surface, it gives attachment to the interosseous sacroiliac ligament. So this sacroiliac ligament, it attach on the iliac tuberosity. Posterior to this interosseous sacroiliac ligament, this iliac tuberosity gives attachment to the dorsal sacroiliac ligament, and superior to it there is a iliolumbar ligament. So this iliac tuberosity gives attachment to the three ligaments. The most of the part gives attachment to the interosseous sacroiliac ligament. Posterior to it there is a dorsal sacroiliac ligament, and superiorly there is a iliolumbar ligament. Another ligament, that is ventral sacroiliac ligament. This ventral sacroiliac ligament, it attach on the convex margin of the articular surface. So this is articular surface and this is the convex margin. So this convex margin of articular surface gives attachment to the ventral sacroiliac ligament. So this is about the ilium, its external features and this attachment.